Most of us are still trying to process the COVID-19 pandemic. It's been a long 2 years. And while the WHO issued a stark warning today saying COVID cases jumped by 8% globally last week, reminding people the pandemic isn't over, the Ontario Medical Association is already looking ahead, asking the crucial question, are we prepared for the next pandemic? The OMA held a press conference about this today. Joining us live to discuss is OMA President Dr. Adam Kassam. Dr. Samantha Green is a family physician at St. Michael's Hospital, and Dr. Ross Upshur is a physician at Hennick Bridgepoint Hospital. Thank you all for joining us tonight. Dr. Kassam, tomorrow marks the second anniversary of the Ford government declaring a state of emergency in response to the pandemic. That was a scary time. There was so much we didn't know. We didn't have vaccines at the time. Before we talk about preparing for future public health crises, what do you think we learned from COVID-19?
Well, we've learned a lot, Lena. We know that public health crises affect all of us individually, but also as a society. It also affects the globe around the world. And we know that with a pandemic of this nature and of this scope, until we address the needs of all of us around the globe, we're going to continue to have a challenge with addressing it not only locally and regionally, but certainly in other countries that continue to experience some of these spikes that we're seeing. Yeah,
we certainly can't run from the issue, can we? Dr. Green, take us back to March 2020, if you can. What was it like at your hospital?
It was transformative, I would say, and devastating.
Yeah, that's probably a good way to put it. Dr. Upshur, what mistakes do you think we made over the last 2 years? I know we continue to learn, but what were perhaps some of the biggest blunders?
Well, I think the biggest mistakes were made prior to the pandemic itself, because we had been expecting a pandemic. There have been a lot of efforts into pandemic preparedness. So it's not so much the mistakes that occurred over the past 2 years. We did the best we could, but we should have done better by being better prepared in the first place. So we should have had updated pandemic plans. We should have acted on the numerous recommendations that were made by, commissions of inquiry after the initial SARS in 2003. So the biggest failing is our collective inability to learn lessons from previous pandemics, which left us quite vulnerable and ill-prepared for this current one.
And never again, Dr. Upshur, do we want to be left this vulnerable. Never again do we want to be caught off guard by a virus like coronavirus. So I'll ask you the question, are we prepared for the next pandemic?
I would say we're taking steps in that direction, but a considerable amount needs to be done. I'll echo what Dr. Kassam said. Pandemic is a global event, and we're only as strong as our weakest link, which means that we have to not only prepare locally and provincially and, nationally, but we have to be good global citizens and strengthen and support, non-governmental organizations and international governmental organizations like the WHO, like the ACT Accelerator, and we have to devote resources to building capacity globally. So it's a tall order, and it's not just coronaviruses. There's other viruses out there that are waiting and that have been expected.
Dr. Kassam, it's always good to talk to you because the OMA always seems to be solution-oriented. So let's talk about solutions now. We know our healthcare system has been pushed to the limit. We've had to pay a big price for the pandemic. We had to cancel non-urgent surgeries. So many people lost their lives. The OMA is now making a number of recommendations, including planning for a, quote, robust public healthcare system. You're also calling for a pandemic plan. Tell us more about this plan.
So, Lena, pandemic preparedness is, as you're describing, is one of the major areas of focus for the OMA, and it was recently highlighted in our prescription for Ontario. And so we have several recommendations that include some of the following. So we need a provincial pandemic plan that includes a mandatory review and update every 5 years, maybe even more frequently than that, to reflect some of the changes in local public health practice, medical science, and technology. We need to implement a standardized pandemic plan across public health units that is sufficiently flexible to account for differences across the province. We have close to 34 local public health units. We also need a governance model that prioritizes the centrality of scientific and laboratory resources during a crisis so that we can ensure that we have a full complement of resources that are coordinated across the province. And then finally, Lena, we need a strategic investment for pandemic planning for public health units so that their resources aren't drained from the other important work that they continue to do on a day-to-day basis.
Dr. Green, what initiatives would you like the provincial and perhaps even the federal government to take to prepare for the next pandemic?
Right. Well, we also need to prepare for the next health crisis that may or may not be a pandemic. We need to prepare for the coming devastation and the ongoing devastation of climate change and the health impacts of climate change on the health of people living in Canada and the health system itself. So I would also like to see the federal government, the provincial government develop an adaptation plan for climate change and a mitigation plan for climate change. So reducing the harms of the health system itself, and also reducing emissions overall. And because we also know that climate change actually contributes to the development of pandemics. So climate change is a driver of future pandemics. So not only do we need to be preparing for the coming viruses, future coronaviruses, future influenza viruses, we also need to be prepared for other kinds of health system disruption and other devastating impacts, in particular of climate change.
Right. Dr. Green, as a family physician, I want to ask you, are we doing enough to protect children and children in the classroom? Is there anything we can do to make sure our children are safe today and in the future?
I mean, I think, yes, it's a very difficult situation right now with lifting of mask mandates, and I think individuals can make decisions about sending their children to school with masks. And I think we need to wait and see what happens with the lifting of restrictions. And get vaccinated.
Yeah, I'm sure you'll be watching the trends very closely. Dr. Kassam, have you had conversations with the Ministry of Health about this? Are you working with the province? Are you hopeful that something will come out of these recommendations?
Oh, absolutely, Lena. We have constant communication with not only the Ministry of Health, but of course other partnered groups, including Ontario Health, including the Chief Medical Officer of Health, including other healthcare organizations and institutions. I think there is a collective understanding as we think about the future that there needs to be a collaborative approach for the future of healthcare in this province and in this country. We know that public health crises, as well as, for example, Lena, the 21 million healthcare services that have gone delayed as a result of COVID-19, we need to get through that, and we need to be able to deliver care not only in a timely and effective way, but also in an equitable way as well.
Okay, we have to move on. I'm going to ask Dr. Upshur about the federal government expecting to announce the lifting of pre-arrival COVID testing at Canadian borders tomorrow. So this means no more testing requirements for those who are fully vaxxed. Doctor, do you feel good about this?
Well, I can't say, I mean, I think it makes sense and I understand the rationale behind it, but I hope there's a very clear monitoring and evaluation program. Many of the restrictions are going to be lifted, but we need to be prepared to put them back in should the data indicate that we're starting to see severe consequences of unchecked spread of COVID-19 once again.
Okay.
So we'll take a step forward and we may need to take a step back.
Okay. I've got about 1 minute left, so maybe I'll give each of you 20 seconds to answer this next question. Come Monday, wearing a mask in this province, in most public settings, that will be a choice, not a requirement. Will you be wearing your mask in indoor settings? Dr. Kassam.
I'll be wearing my mask in areas where it's hard to distance, in areas where there is a high volume of individuals, and I'm confident that people will make their decision based on their risk assessment, but also their comfort level. Okay, Dr. Upshur?
Yes, I'll be wearing a mask. I have no interest in contracting a respiratory viral infection, including COVID-19.
Dr. Green?
Yes, I'll be wearing an N95 mask because we know with one-way masking, that's what's needed.
Okay. Thank you so much. We'll leave it there. Thanks for your time and this discussion. Dr. Adam Kassam, Dr. Ross Upshur, and Dr. Samantha Green.
Thank you.
Thank you.